today. And I'm pleased to welcome you all to the press meet of Virinchi Hospital, incomparable kidney transplant against all odds. Department of Nephrology of Virinchi Hospitals is the center of excellence for complicated kidney transplants.
And our esteemed members of press and our consultants, experts from Virinchi Hospitals, and also our valued guests. Today, my speech will be focusing on the medical excellence, specifically the Center of Excellence Department of Nephrology, and the economically favorable clinical practices that we have implemented across all departments, specifically nephrology, and the world-class healthcare that we offer on a day-to-day basis. And I thank you for joining today as we gather to share a significant milestone in healthcare, a remarkable medical achievement that has unfolded within the walls of Virinchi Hospitals, reflecting our commitment to innovation, excellence, patient-centric care, and sustainable practices. In recent weeks, our medical team, led by our visionary surgeons and specialists, undertook a rare and challenging kidney transplantation procedure on a patient who had bravely faced the consequences of thrombotic microangiopathy, leading to kidney failure. This condition presented unexpected challenges, pushing our medical experts to devise a unique protocol that not only exemplifies medical excellence but also integrates economically sustainable practices for improved and lasting outcomes. Today, we are proud to announce the successful completion of a rare kidney transplantation that marks a paradigm shift in our approach to healthcare. This transformative procedure not only showcases our commitment to pushing the boundaries of medical science, but also reflects our dedication to ensuring these advancements are economically viable for the long term. What sets this achievement apart is not just the successful transplantation itself, but the innovative approach we embrace to navigate unforeseen challenges. Through meticulous planning and decades of experience, we have not only enhanced the efficiency of the procedure, but also significantly reduced associated costs. This aligns with our broader vision of making advanced medical treatments more accessible and sustainable for our community. This achievement is a testament to collaborative spirit of our hospital staff, the resilience of our patients, and the unwavering support of our management and our community. It signifies our commitment to exploring innovative solutions that address not only the immediate health needs of our patients, but also the broader economic considerations that impact the healthcare landscape. As we celebrate this success, we remain focused on our mission to provide world-class healthcare that is not only effective and compassionate, but also economically sustainable. Our dedication to these principles will continue to drive us as we navigate the challenges and opportunities that lie ahead. We look forward to sharing more breakthroughs as we strive to make a lasting impact on health and well-being of our community. I thank one and all once again for making this a remarkable event, remarkable outcome happen for Virinchi Hospitals, and thank once again the press for being here to taking this to the public through your humble media post. Yeah, thank you so much once again.
మా మీద నమ్మకం ఉంచి మా సేవల్ని వినియోగించుకున్న కిడ్నీ ట్రాన్స్ప్లాంట్ పేషెంట్స్ కూడా చాలా నమస్కారం. ఇప్పటి వరకు ఈ సంస్థలో 2500 పైగా కిడ్నీ ట్రాన్స్ప్లాంట్స్ చేశారు. ఈ కిడ్నీ ట్రాన్స్ప్లాంటింగ్ నెఫ్రాలజీ టీంలో దీని ఆధ్వర్యం డాక్టర్ కెఎస్ నాయక్ గారు. I would ask Nayak Garu to please stand up because he is one of the top 10 nephrologists in the world. and we are really honored that we have an eminent nephrologist of that caliber who's working with us and guiding us in terms of setting up the Center of Excellence and running it very successfully and focusing on quality and not on quantity. So in net terms, we were the first to have done the first cadaver kidney transplant also in the United AP, and we do have licenses to do kidney and also liver transplants, and Dr. Naik is the chief advisor and the chief protagonist for both, and under his leadership we look forward to delivering other breakthrough solutions. ఇందాక సిఓఓ గారు శామ్ ధవల్ గారు చెప్పిన విషయం ఏంటంటే ఈ ట్రాన్స్ప్లాంట్ ఈ రోజున పేషెంట్ గారు తీసుకున్నటువంటి ఈ ట్రీట్మెంట్ విధానంలో చాలా సునిశ్చితమైనది, చాలా కాంప్లికేటెడ్ అయిన ఏబిఓ కేస్ని మన సర్జన్స్ నవీన్ కుమార్ మెట్టవాడ అండ్ నవీన్ మేడి అండ్ అండర్ ప్రొఫెసర్ డాక్టర్ జయరామ్ రెడ్డి గారు, వారు మనకి ఎంతో ఆప్తులుగా ఉండి ఈ యూరాలజీ నుంచి వారు కూడా ఇచ్చేస్తున్నారు. జయరామ్ రెడ్డి గారు మీరు ఒకసారి నించారు. I want people to applaud Naveen Kumar, Metawada and Naveen Medi. No, this constitutes the whole of the transplant team under Dr. Nayak and Harish. Harish, please stand. Harish is our in-house urologist, and Dr. Raghavendra, chief and head of anesthesiology. So, surgery sarigga sakramanga kavalanante nursing and ICU teams very received, but the whole execution requires a complex web of collaboration and cooperation. So you may please be seated. In other words, we have been focusing in terms of delivering rare and complex and complicated cases in this hospital, Virinchi, where we have believed in right to science. So that being our driving paradigm, we shall always endeavor to bring to bear treatments at an optimal cost. So last year we performed a very rare interstate inter-swap kidney transplant between a couple from Chhattisgarh and Telangana. First interstate. So, and then intercity in the country also. So we have won that distinction, and now we were able to help this complication in the patient by doing a surgery, well-planned surgery. ఇందాక శామ్ గారు చెప్పినట్టు ఇలాంటి కేసు యూకేలో కూడా వచ్చింది. దానికి ఒక ఇంజెక్షన్ ఖరీదు 4.5 లక్షలు. అలా ఇంజెక్షన్లు తీసుకుంటూ వెళ్తే సంవత్సరానికి 1,25,00,000 ఖర్చు అవుతుంది. అలాంటి కాంప్లెక్సిటీ లేకుండా ఇక్కడ మనం ట్రాన్స్ప్లాంట్ చేయడం ద్వారా మనకి చాలా అతి తక్కువ ఖర్చుతో ఈ ట్రాన్స్ప్లాంటింగ్ చేసి విజయవంతంగా ట్రాన్స్ప్లాంట్ చేయడం ఒక ఎత్తైతే పేషెంట్ అవుట్కమ్ వారి తాలూకు చక్కగా కోలుకుని మళ్ళీ వారి తాలూకు నార్మల్ దైనందిన కార్యకలాపాలు చేసుకోవడానికి కూడా వారు చక్కగా ఉన్నారని చెప్పి వారే చెప్తారు. నేను ఇంకా ఎక్కువ చెప్పడానికి నాకు ఛాన్స్ లేదు, అవకాశం. I don't want to stand between the patient testimonial and rest of you, but once again I thank the patient family and the patient attendants from the bottom of my heart for reposing trust in us, in Virinchi and in Virinchi nephrology team, and we do look forward that this be well spread so patients who are in need can benefit from the Center of Excellence under Dr. Naik. Thank you very much.
And our Satya Vedula sir has already told you. I'll tell you the details about this case. Why is it so complex, and what are the innovative things which we did? I'll try to explain it as simply as possible. But if at all something is not clear, please feel free to stop me at any time and ask. So, Mr. Raman Kumar Singh, He is a 37-year-old gentleman from Jharkhand. He has approached us last year in around September seeking kidney transplantation. So when we have evaluated him, what we found is the basic cause of his kidney disease is a rare disease called thrombotic microangiopathy. So if you look at like most common cause of kidney disease in India, it is diabetes or CKDU, which are fairly straightforward, and transplantation in such cases is straightforward, and it is easily done in many centers. But what he had was thrombotic microangiopathy. In simple terms, like it is thrombotic microangiopathy means he has blood clots in small vessels in his body. Like it includes all the organs. Like the small clots can form in the blood vessels of the kidney, heart, liver, and it can form in brain also sometimes. So because of this, patients usually develop multiple organ failures. They can have cardiac dysfunction in addition to kidney failure, and they will have other manifestations like because there are blood clots, platelet count will come down, hemoglobin will come down, and they will have neurological issues like seizures and altered, like they can go into coma. So when he came to us, one thing was his disease was confined to the kidneys. But what makes it challenging is thrombotic microangiopathy is not a single disease. It is a spectrum of diseases, and it has multiple causes, and it can be caused by something as trivial as a diarrhea and pneumonia, and causes extend till like there are some drugs which can cause, and there are some genetic abnormalities in the coagulation system, complement system, and some abnormalities in the cell metabolism itself that can lead to TMA. So ascertaining what has caused thrombotic microangiopathy in such patients is a challenging issue, and we'll have to do a detailed evaluation to find out what has caused, because when we look at somebody with kidney problem who has approached us for kidney transplantation, the question that comes to our mind is, what is the chance that he will have a recurrent disease once he gets transplanted? If we don't do this detailed evaluation and we overlook any causes, the new kidney which is transplanted can also develop the same problem. So it becomes very essential in the pre-transplant evaluation itself to ascertain what has caused this kidney problem in the first phase, and whether there is any chance of recurrence, and if so, what can be done to prevent that recurrence. So that is how we look at it. For him, looking at his issue, we have done a detailed evaluation looking for genetic abnormalities and antibodies against the complement system, like abnormalities in his cell metabolism, all those things. And we have ruled out other causes like infections and previous drug usage, all those things. And we have decided to go ahead with the transplantation. But thing is, like ABO compatible transplantation, like when the blood groups of the patient and the donor match, that is the ideal transplantation for a patient with thrombotic microangiopathy. And ideally it should be because there is a genetic component to the disease, even the donor should be evaluated for if family members, they can also have the same problem, and they should also be evaluated before proceeding for transplantation. So when he came to us, only available donor was his elder sister, and she was not a blood group match. So even then, initially we evaluated for genetic abnormalities, and then decided to go ahead, but ABO incompatible is an issue there. And one more aspect of ABO incompatible transplantation is ABO incompatible transplantation itself can cause this thrombotic microangiopathy if the antibody levels are very high. So this has added more complexity to the case. A case of thrombotic microangiopathy, which can have very high recurrence rates, depending on the genetic abnormality, it can go up to 90% post-transplant recurrence. And added to that, there was one more risk factor, that was ABO incompatible transplantation, that can again increase the risk manifold, and that can lead to loss of the graft, and it can sometimes be like because of associated low platelet count and low hemoglobin, there can be risk to the lungs also. So that is where we had a detailed discussion with patient and his attendants, and then we decided to go ahead. And again, we had to plan up the management in case of recurrence.
Vice Chairman, dear colleagues and my dear friends and esteemed media members, a warm good afternoon to everyone. So first of all, I thank each one of you who have gathered here in spite of their busy schedule. And it's my privilege and honor to announce that the Department of Nephrology, Virinchi Hospitals, has successfully performed a rare kidney transplant of ABO incompatible transplant in a patient of TMA with immediate post-transplant recurrence managed effectively at low cost and with excellent graft outcome. One such a kind of transplant it is first in India and worldwide itself. So before going to our patient details, I would like to brief what is ABO incompatible transplant and what are the must points which we should know before knowing our patient details. So kidney is one among the most common organs to be transplanted in the human body. We do have other transplants like liver, skin, intestine, lungs, etc. Kidney is one such an organ. It is highly immunogenic. It means once it is a transplant, I will try to explain in Telugu as well. Once it is transplanted, our body performs antibodies, produces antibodies against the kidney which is transplanted, and it tries to reject the kidney. So for a good transplant or good acceptability, we should make the patient prepare for the transplant for good graft survival and better acceptability. So generally transplant is done in the same blood group. For example, A blood group ఉన్న patient కి A blood group ఉన్న డోనర్ నుంచి కిడ్నీ ఇస్తాము. ఎగ్జాంపుల్ A to A, B to B ఇలా జరుగుతుంది. బట్ కొన్ని సమయాల్లో డోనర్ దొరకనందున వేరే ఏమైనా ప్రాబ్లమ్స్ అవ్వడం వల్ల we will try to get a donor from other blood group. So this is called ABO incompatible transplant. So generally with the latest advances and the latest research and the latest drugs like rituximab, eculizumab, the different types of plasma exchange therapies, immunoadsorption therapies. So we have tried to make a success in ABO incompatible transplant. So approximately 2 to 3 lakh patients in India need transplant per year. But in India we perform approximately 6,000 to 8,000 transplants only in a year. So to combat this, in addition to live transplant, in addition to disease transplant, in addition to swab, ABO incompatible transplant alone itself can increase the donor pool to 25 to 30%. So overall results ఎలా ఉంటాయి ఈ ట్రాన్స్ప్లాంట్ లో when compared to ABO compatible. So over time it can be either short term అయినా long term అయినా same. It is like same graft function and same patient survival when compared to ABO compatible. So patient preparation ఎలా ఉంటుంది ఈ పేషెంట్స్ లో జనరల్లీ ట్రాన్స్ప్లాంట్ అనేది మేబీ 15 to 1 week ముందు రెడీ చేసి స్టార్ట్ చేస్తాం. బట్ ఇన్ దిస్ కైండ్ ఆఫ్ ట్రాన్స్ప్లాంట్స్ మన పేషెంట్ని 1 month నుంచి ముందే ప్రిపేర్ చేసి ట్రాన్స్ప్లాంట్ చేస్తాం. సో కాంప్లికేషన్స్ అదనంగా ఏమైనా ఉంటాయా ఈ టైప్ ఆఫ్ ట్రాన్స్ప్లాంట్స్లో? డెఫినెట్లీ ఇన్ దిస్ టైప్ ఆఫ్ ట్రాన్స్ప్లాంట్స్ వీ హ్యావ్ రిస్క్ ఆఫ్ ఇన్ఫెక్షన్స్
and risk of rejection, TMA, when compared to other normal transplants. But this can be prevented and managed very efficiently with the proper care. So, knowing these complexities of ABOI transplant and the basic disease of TMA, which Dr. Naveen Matevara has already discussed. So, TMA is a dreaded disease which has high risk of recurrence itself post-transplant. With a combination of these two entities, and TMA and ABOI, despite the heightened risk associated with this approach, including the potential for TMA recurrence and graft failure, patients' strong desire for transplantation and robust familial support prompted us for the strategic discussion between our nephrology team and the patient's family, and finally we went ahead with the transplant. So now, coming to our patient details, recipient Mr. Raman Singh, blood group being B group, and elder sister sibling, Mrs. Tinku Singh, only available donor, with the blood group of A. After a comprehensive pre-transplant evaluation, including genetic and complement analysis, received appropriate pre-transplant medication, including rituximab for the recipient. The surgical procedure performed by our world-class experts of surgeons and anesthetists with meticulous attention to blood pressure control during the procedure to mitigate the risk of TMA recurrence was completely successful. However, the patient experienced a recurrence of TMA within hours of the transplantation post-procedure. Promptly identified and treated through plasma exchange and rituximab administration. He responded to treatment and was discharged with a good urine output and good graft kidney function after 2 weeks of the hospital stay. So currently our patient is post-operative 2 months, doing extremely well with the normal graft function and a happy lifestyle and a healthy lifestyle. So I once again express my heartfelt gratitude to all the who are present here, and thank you for the patient hearing. Thank you very much.
Everyone, respected doctors, respected administrative, CEOs and CEOs, press, everyone, welcome. I'm so happy that you guys are here to listen to my story and our story and story of Virinchi Hospital and how good they are doing. So I'll try to keep it brief, but also try to keep it genuine. You have already heard from the doctors who have, taken care of me and taken care of my case, and must have already a good idea about how expert they are and how much they know about me, which even I don't know. But I'll tell you the story of a patient, or my story as a patient in terms of how otherwise a healthy person, 33, 34, having a very good life, not having any disease. Thank you, sir. Not having any disease, and having a very normal life. Never heard words like creatinine or renal or, these terms. Having a normal life suddenly starts experiencing, some symptoms which are very common to CKD, and started experiencing high blood pressure, goes to a doctor and hears this term called CKD. Okay, what is that? It's a chronic kidney disease. Well, I know there are a couple of kidneys in my body, but what about this disease? Well, it's a bad disease, it kills people, and it's a bad disease to have, but that's all I know. And then in January 2021, by some of the very good people and some of the very well-known people in my life, I have been sent to Hyderabad to a doctor called K.S. Nayak. And they say, look at your case, you should immediately go and meet one of the best in India and see what's this all about. Jan 2021, I come here, I meet my doctor, I have no idea who he is. I just know he's renowned as a nephrologist, but I at this point don't even know what nephrology is. So I am very good at what I do, but have no idea about this medical condition. Telugu is not my mother tongue, so I try to keep it in English only, but if anybody wants to listen to a Bhojpuri song, I can make you hear after this. That's my mother tongue. But anyways, coming back to the story is 3 years I have been in touch with Dr. Nayak. I have, in my personal and professional life, never met such a professional person who is so loving, a father-like person. And very early in the process, he made me confident that he has exactly right idea about what my condition is and how it can be cured and what will be the phases I'll go through, and in every phase what should be our approach. So I'm otherwise, a patient who asks too many questions and is always like a little uncertain. So I make my doctor's life a little complicated, which is I ask a lot of questions, I make a lot of noises, and at every point I'll say, is this necessary? Which kind of makes my doctor's life not very easy. But Dr. Nayak and his team has been very patient with me throughout my journey. And very early in the process, he made sure that you don't need dialysis. You can very well be taken care with medicines for a very good 5 years based on your condition, your lifestyle. And a time will come when you might need a transplant. So kind of make up your mind for it, but then we will be in touch. So you don't have to worry about it. That whole journey is the reason I did my transplant in this hospital. So I want to give like 99% of the credit to Dr. Nayak in terms of being such a busy doctor and such a big doctor. He still spends a lot of time with his patients and makes sure that understand his patients' insecurities and try to address them one by one. And every member in his team has this quality which I think he personally trains them. But somewhere in August, I came as my creatinine was somewhere around 8, and he said the time has come. We have been in touch, but you should now start looking for your donor. My sister, who was at this point AP incompatible, I still again, as I said, I have no idea what AP incompatibility is, what TMA is. All I know is these are bad terms, and as normal patients, we should always trust our doctors in terms of what it is and how to address it. Just give us all the right suggestions and make sure it's not too hard on our pockets, right? And that's exactly what happened with me. I brought in my sister and they did a very, very extensive pre-transplantation research of almost 1.5 months. And again, I want to apologize because I have been impatient during that period and I've been poking them, asking, I am here, my sister's here, what's taking so long? Can you not transplant it? And I, just being ignorant in terms of not understanding how complicated my case is, which has just been explained by our doctors. So, as I said, I'm extremely thankful in terms of that research which was done meticulously by all the doctors, and at every stage they were explaining what we are doing, why we are doing it, and when the time came, they said, based on all we know and based on all your conditions, this is how we should proceed. And not only me as a stakeholder, but my family members who are extremely important to me, and they are also one of the reasons I'm here happy and healthy. So we did the transplant. Now, as I said, CKD is a common disease. It happens to a lot of people. Kidney transplants are also very common nowadays. But at this point, I had no idea how rare my case is. And only after transplant, when things started to go south, I had huge appreciation for Dr. Nayak and his team in terms of how they already foresee what was about to happen or what could be went wrong or gone wrong. And they were ready for it, and they spent nights with me. Like, there were doctors throughout the night in KTU, literally sitting on my chest and making sure that I am all right. There were people from dialysis department doing plasmapheresis every other night, and answering my stupid questions and just making sure that I am psychologically in a healthy state. And as I said, I'm not an easy patient, so I do make a lot of noise. But throughout this, they were extremely patient. They made sure that I am, I'm out of it. And I, with best of my abilities, tried to get out of it because I'm otherwise a young person. I have a good amount of life left, right? So I was committed that I'll get out of this place in a very healthy state. So I would say I was kind of coordinating with them in the best way possible, but what made this whole thing very fruitful for me is 3 years back I was a person who was asking questions to myself, is like, why me? why I had this disease, I did nothing wrong, I don't have any bad habits, to a place where I suddenly said, well, I was lucky enough that I was at the right place at the right time, which means I had all the right doctors, I went to the right place, I met right people, I have right people in my life, which includes my elder sister, my wife, my mother, and they all have been very supportive. So a lot, it might take one disease to give you a bad time, but it takes a lot of people to pull you out. So I think the relationships which I have built over the years and the kind of goodwill this hospital has given me in terms of facilities, in terms of good team of doctors, in terms of nursing staff. My nursing staff has been extremely careful about how I have been taken care of. I want to take some names. So in doctors, Dr. Nayak, Dr. Naveen Methiwara, Dr. Naveen Medi, Dr. Lekha, Dr. Ram, Dr. Rama, everyone in Nephro team has been extremely kind to me. Other than that, from surgical department, Dr. Jairam Reddy, Dr. Harish sir, and Dr. Raghavendra from anesthesia. I have no memory of any pain, so great hospital if you guys are planning. In coming to nursing staff, and I think that's very important, I see Dr. Martha, but Martha and then Sai Rekha, Nagarjuna, Nagaraj, everyone, and couple of staff who were taking care of me. I'm extremely thankful to them. This place has such a nice vibe in terms of, I come from Jharkhand. I have a huge respect for Telugu as a culture, Telugu as a language, but I've only experienced it from far until this period, and I am extremely happy that I made all the right decision. The serving nature of people here, in terms of somebody has come from outside, they have no sense of our language, but they are in trouble and they need to be helped, and we will help them and we will let them go to this place, or when they go out, they have a good memory of this place and this state. And I have seen that behavior in everyone in this hospital, like literally everyone, from the person who takes money for tests, or the guy who takes my samples, everyone. So I would say, if you are someone who is either going through a tough time in your life in terms of either kidney or something else, this might be the right place where you immediately started getting into consultation and then start listening to what the experts has to say. My personal experience has been super nice, and all this I'm saying not just because I have kind of got my treatment here, but I do talk to people who have gone through similar treatments in other parts of India. Like I have friends in Bangalore and Delhi and Chandigarh who have went through similar, or whose family members have went through, and both in terms of quality, in terms of money, and in terms of keeping the patient informed on a periodic basis on what's happening and what might happen. We don't get that in other parts of India, and I might be wrong, but that's what my experience says. So that said, I am happy I came here. I am happy I am in a very healthy state. My prognosis is still a work in progress. I might look very healthy, but I still have some more improvements to make, and I have 100% faith in Dr. Nayak and his team. We will continue to be in touch, and I will make sure that this comes out as a great story, and more people are encouraged to get their kidney transplants done. Even if you have complications, and that can be of any nature, please come here. This will get addressed, and you will get the best treatment. So thank you very much.
पता चला मेरे भाई का तबीयत किडनी का प्रॉब्लम था, तो मैं इच्छुक थी देने के लिए, लेकिन फिर पता चला कि अलग ब्लड ग्रुप है तो दिक्कत हो सकती है। फिर नायक सर ने भरोसा दिलाया कि नहीं, हम लोग अच्छे से कर लेंगे ट्रांसप्लांट। फिर टेस्ट वगैरह हुआ और ट्रांसप्लांट सक्सेस रहा, है ना। नायक सर, नवीन मेतिवारा सर, नवीन मेदी सर, सब ने बहुत सपोर्ट किया। मैं एक हफ्ते तक रही हॉस्पिटल में। हॉस्पिटल भी बहुत अच्छा, कहीं कोई दिक्कत नहीं, सब ठीक ठाक रहा।
To sing for
sharing your experience. Now I'd like to call upon.
Yeah, we moved to throughout the journey. Sir, I got married in 2020. On 30th of November, I got married. And by 1st or 2nd of January 2021, he got to know that his blood pressure was very high, and we got to know this term, that is CKD, chronic kidney disease. The biopsies were done, and we were in a hospital in West Bengal. There's a place called Durgapur. So we were there, and the biopsy was done, and that TMA came, that Thrombotic Microangiopathy, right? And they said there is no stop here. His kidneys are 85% damaged, and he was in the 5th stage of stage, right? And we were said dialysis is the last option you can go through, and we were sent home. But by 10th of January, we came to know about Sir, and he's like one of the best nephro that anyone could come up to. So we were here. Sir took him in for 15 days. He was here. Every possible test were conducted, and Sir, that very day, Sir said, with medicine, I promise you, I can stretch his kidneys life for 3 years, and exactly that happened. For 3 years, he was on medicines which was prescribed by Sir. Every month we used to get the tests, and Sir used to reply at any order, whatever happens, whatever things we used to experience, we used to message Sir, and Sir, no matter it is 12 at night, 1 at night, he used to reply, he used to control doses throughout. And for 3 years we were in constant touch. We used to come here yearly, and when he was here in August, his creatinine was at 8. Sir asked me, now we have to go through the transplant and just talk to in your family. Sir suggested for the siblings, and his sister was very eager to give. We were here by September, and Sir left no stone unturned to make this possible. Every test were done very thoroughly, and by 2nd of November his transplant was done. Again the TMA came, but they were very supportive. All the doctors were very supportive. They made me understand what was happening, what is going to happen, how they are controlling everything, and they not only supported us in a medical way but also emotionally, right? So not once, twice or thrice, we'll be in touch throughout my life. Like we may be like any other patient to him, but he is like only our last stop. Like we went to several places, but all of them were recommending dialysis. Like it's a very complicated case. Dialysis is only possible, but this was our last hope, last place, and Sir made everything possible for us. And whatever we say, whatever we do, it will never be enough to thank Mr. Nayak and his team. So thank you so much.